Welcome back to our regular column, Ask the Doctor. I am Dr. Wale Okedino, a medical practitioner, family health physician of 45 years at work. As before, today I will be answering 8 questions from my patients. These are common questions that have been worrying them, and I will take them one by one. The first question is about exposure to the HIV virus. So the question goes thus: I had unprotected sex with someone whom I later realized was HIV positive. Can you let me know how long it will take for symptoms to appear? So, and the answer is that in the past, it used to take a long time, maybe about 3 months, before the virus will appear. But now we have what they call a rapid antigen antibody test, which can be done with blood from a finger stick, and this can detect the virus from 18 to 90 days after exposure. And also, there's another laboratory test that can be carried out by taking blood from your vein. This one will also detect the virus between 18 to 45 days after exposure. Another test called nucleic acid test can usually detect this virus 10 to 33 days after exposure. So you will need to visit the laboratory near you to know which of these tests they offer, and that one will help you to know whether you are HIV positive or not. The second question is about tuberculosis, and it goes thus: my 70-year-old uncle has been having sleepless nights with night sweats, cough, fever, and chest pains for the last 2 weeks. I'm afraid if it's not tuberculosis, please advise me. So the uncle has been having sleepless nights. He doesn't sleep at night. He only have night sweats. The uncle coughs a lot. He has fever and chest pains. So my answer is that most people infected with the bacteria that causes tuberculosis don't even show symptoms. However, by the time the symptoms do occur, they usually include a cough, sometimes with a little blood-stained cough, blood-stained sputum. When they cough, they bring out this blood-stained sputum. Then some of them lose weight, they have weight loss. And just like your uncle, they can also have night sweats and fever. People may also experience other symptoms ranging from chest pains, chills, fatigue, loss of appetite, general malaise. Also common, you can have some wasting of the muscles, that is muscle atrophy, shortness of breath, and swollen lymph nodes. In view of this, because since your uncle was already having some of these symptoms, your uncle needs to see a doctor for proper examination and appropriate laboratory examination. The laboratory examination may include blood tests, may include the sputum examination, and also a chest x-ray. So this will help to confirm whether or not your uncle has tuberculosis. And if he has, there will be treatment for it. The third question is about a sinus infection. For those of you who are familiar with sinuses, the sinus is some of the air bone area in the top of your mouth. So that's the sinus under the nose. So the question goes thus: I've been having cold and catarrh for the past few weeks. On my last visit to the doctor, I was diagnosed with sinusitis. Although my doctor tried to explain what this is, I would still appreciate it if you can explain what sinusitis is. That is, what is chronic sinus infection? And my answer is this: sinus infection, called sinusitis, is an inflammation of the sinuses The sinuses are the air-filled cavities around your nose, eyes, and cheeks. And this infection can be caused by viruses, bacteria, fungi, or allergies. And some of the symptoms that come with this include facial pain, congestion, nasal discharge, headache, cough, fatigue, and a reduced sense of smell. Acute sinusitis will last for a short time, while chronic sinusitis can persist for more than 12 weeks. Common causes of sinusitis include respiratory infections, nasal polyps, or a deviated septum. That is, septum is the tissue that divides the nostril. If it's deviated, it can lead to sinusitis. So, in addition to medications prescribed by your doctor, hot steam inhalation with some lifestyle changes will go a long way in the cure of sinusitis. So we go on to the fourth question, and the question has to do with hypertension. The patient wants to know whether there are some natural ways to cure hypertension. His question goes thus: I have been on medication for hypertension for many years, and hypertension, as you know, is raised blood pressure. You see, I've been on medication for hypertension for many years. Can you let me know if there are some natural ways for me to manage my hypertension? And my answer goes thus: natural remedies for reducing high blood pressure may include dietary changes, exercises, stress management, and specific herbs or supplements. Adopting a diet rich in fruits, vegetables, and low-fat dairy, reducing your salt intake, engaging in regular physical activity, managing stress through techniques like meditation, and taking some supplements like potassium or omega-3 fatty acids can help you to control your blood pressure. However, it is crucial to consult with a doctor or a certified healthcare provider before implementing any significant changes to ensure safety and effectiveness. And it's important to also check your blood pressure regularly through a certified medical provider. The next question, question number 5, it has to do with blood in the urine. And the question goes this: he said, I noticed I'm a 30-year-old young man. I recently noticed that blood usually comes out when I'm urinating. Please let me know what is causing this. That is, when it's urinating, he urinates blood. And my answer is this: it can be very scary to see blood in your urine. And in medical terms, we call it hematuria, that is, blood in the urine. And in many cases, the cause can be harmless. But blood in urine can also be a sign of a serious illness. If you see blood in your urine, it is what we call gross hematuria. Blood that cannot be seen with naked eye is called microscopic hematuria. This is a small amount of blood that can only be seen when you do lab tests. Either way, once you see that there is blood in your urine, it is important to figure out what is causing this. And causes of blood in the urine can vary. It could be from a urinary infection, it could be from kidney infection, it could be a bladder infection or bladder or kidney stone. It could be an enlarged prostate, it could be a kidney disease. It can be from cancer of maybe the bladder or the kidney, or it can also be due to injury. Maybe you went for a sports activity and somebody bump into you or kick you in your loin. It could be an injury to the kidney, or in a road traffic accident. This could also be a form of caused from a trauma from any source. And since the treatment of blood in urine depends on the cause, it is always advisable to see your doctor so that he will listen to your story You will listen to your history, you will do general medical examination, and then you will order for some tests, ranging from x-rays, ultrasounds, and then can take some sample of urine for examination. The sixth problem has to do with pile. And the question goes thus. I have piles which I've been managing with some medications for the past few months. The case has now gotten worse. Can you let me know how to manage it? Well, the answer, I said the quickest way to alleviate symptoms of piles, which we call hemorrhoids in medical language, is through some various home remedies and lifestyle changes. These include increasing your intake of fiber, that is, from your fruits and vegetables. You can also increase, consuming more fiber-rich foods such as fruits and vegetables, whole grains and legumes. These can help you to soften stools and make them easier to pass. And when you do this, you don't have to get constipated, and it will reduce straining, because straining is one of the reasons for pushing out pile. And then you need to stay hydrated by drinking plenty of water, and this one also helps to prevent constipation. When you have hemorrhoids, maybe coming out from your anus, you can prepare what we call sitz bath. That is, warm water, take some warm water and put salt inside it. Then you can sit inside this for 10 to 15 minutes, several times a day. This will reduce the swelling of the pile and reduce pain. There are some over-the-counter creams and ointments that you can buy at the pharmacy. These topical ointments, we have some drugs inside them that can help you to reduce pain and swelling with hemorrhoids. And also, it is important to go to toilet regularly. Some people, when they have the urge to go to the toilet, they want to delay it, maybe because of lack of toilet facilities or what. This will now cause you to get constipated, and by the time you go to toilet, it will have worsened your pile. So it's important for you to go to toilet regularly, eat plenty of vegetables and fiber-rich foods, take plenty of water, and if the pile is still disturbing you, see a doctor to give you a complete checkup. The second to the last question has to do with dandruff. The questionnaire is asking that, saying that my 10-year-old daughter has had dandruff for the past few months. Unfortunately, all the medications I've given her have not helped. Please help me. And my answer goes like this: that dandruff is when you have dry flakes of skin on your scalp. It happens when a lot of dead skin cells build up on the scalp. The most common cause of dandruff is what we call seborrheic dermatitis. This is a type of eczema that can develop where the skin is oily and very hairy. It has also been confirmed that stress, cold and dry weather, and with mind allergy can also make dandruff worse. Dandruff is not contagious, and is very common in children and teenagers and adults. And usually dandruff occurs in a child when he reaches puberty. The puberty, that's when you are having some sexual signs in your body. Because this is when the oil glands become more active. And the most common symptom of dandruff is to have a dry and itchy scalp. The scalp can be sore and can be inflamed. And the way to solve it is to buy some medicated shampoos from the pharmacy or supermarket. You can ask the pharmacist, he will let you know the kind of shampoo to buy. So when you want to use it, make sure that your child's hair is brushed, so that after brushing, it will have removed some of these dead flakes. Then you now apply the shampoo, and then allow the shampoo to to stay there for some time, for maybe 30 minutes before you now wash off the shampoo. By the time you use the shampoo, it will bring out all the dead scales. And if you want to make sure that the dandruff does not come back, you can put your child on some medicated shampoo, because the medicated shampoo will also help to reduce the shampoo. You can use the shampoo maybe once or twice a week. Then the last question is about COVID-19. Yeah, the patient is asking whether COVID-19 is still around, even though we know that it was a big epidemic before, but now that is people still believe that it's still around. And my answer is that, well, people still say that some variants, that is some types of COVID-19, which may not be as severe as before, are still around. When you see people with signs of flu, sneezing, influenza, and catarrh, body aches, poor sleep, neck pain, headache, and shortness of breath, especially after traveling to a different area, then you can suspect that this is a variant of COVID-19. And luckily, it has been confirmed that those who have been vaccinated, they don't have much thing to worry about, because even this new variant, all you need to do is to isolate yourself, take plenty of fluids, take things that will remove the cold and catarrh, try some hot water inhalation, and reduce your activity, take some rest, and take some usual medicine for pain like paracetamol, vitamin C, and increase your fluid intake. And drink plenty of water. It can be tea, it can be some orange juice. Once you do this for a few days to a week, all the symptoms will disappear. The important thing is to be careful when you travel and you see in a crowded bus or crowded transport facility, and you find people who are coughing or who have severe catarrh and cold. You can always use a mask to cover yourself. So this will come to the end of this session of question and answer. And once again, I am Dr. Wale Okedino, a family physician of 45 years in practice. Next session, we shall take more questions from our patients. Thank you for now. Bye-bye.